Well, we may now be past the peak of the first stage of the virus, but it's clear the UK will have to inch out of the lockdown very carefully indeed. As the government announced that new funding for those who need extra support during the lockdown, in private, many discussions are being held on how best to ensure that people can feel safe enough to slowly start getting back to a new normal, whatever that looks like. Test, track and trace has been the government's mantra for how we might begin to re-emerge, and a key element in doing that is a mobile phone app being developed by the NHSX digital team that aims to track, trace and alert users when they've been near somebody who has COVID-19. The app is expected to begin trials in the Isle of Wight from next week before the rest of the country can download it, although privacy campaigners say they have reservations. One dilemma is the more information it collects, the more useful it is, but the more intrusive it feels, the less likely people are to download it. And ideally, the majority of us need to use it in order to make it any use. Well, I'm joined now by Allyson Pollock, a Professor of Public Health at Newcastle University. Thanks for talking to us today. You were watching that briefing today. First of all, does it feel, from the figures that we've been hearing today, that we really are over the worst of that first peak?
Well, I don't really feel in a position to judge because the death data are never completely up to date. And we really should be waiting for the weekly returns from ONS, that's the Office of National Statistics, which give the correct and accurate recording of data. And I think it's a great shame that the government gives out these data. And they are every day because they don't mean a lot, because they're not up to date and they're not always accurate, as we know. The other problem is, of course, they're not reporting on the excess deaths due to the non-COVID. What we know from the Office of National Statistics are there are a lot of excess non-COVID deaths that are resulting from the lockdown. Deaths that are probably occurring due to people not getting the cancer care or the treatments that they actually need. So I think really we should be waiting and looking at these official statistics every week instead of this daily reporting. I mean, I think it's being used as a tool to enforce a lockdown.
On that point, that there was an admission today of how tough it is for the extremely vulnerable to carry on shielding themselves, staying at home, often alone.
Yeah.
I mean, can people continue to do that without suffering ill effects, be that in terms of their mental health or their physical health?
Yes, I think this is an enormous hardship for everybody, but especially older people who may not have very much longer to live in their lives. And so, indeed, nursing homes now should be making arrangements so that you can have at least one member of the family visiting. I mean, that would be good for the individual, and there should be a designated member, and that's beginning to happen, for example, in New Zealand. I think this idea of people being in solitary confinement, which is like prison, and also dying on their own is inhumane and it's barbaric, and we've never had anything like this before in this country. It's really, for this sort of epidemic, it's really quite barbaric.
Dr. Jenny Harries talked about the way out, in one sense, which was needing clear information, and one element of that will be this track and trace app. How would that work or help as it's currently configured?
Well, again, it was very short on detail. Jenny gave an account of how contact tracing worked, but it was very much a general principles. And I think there's a real concern about the direction of travel, and that's being expressed by many scientists, that what's actually happening is that the government's going for the NHSX app, being developed by multiple private sector developers, instead of a local contact tracing approach. And this app has had a number of problems identified. First of all, it's got a very low, it requires a very high uptake. The Oxford group have said it needs 60% to make it work. So you need lots of people downloading it on their phones. But we know that older people aged 65 and over, many of them don't have phones, and only 40% of them use the internet on their mobile. So you're going to get very low uptake. And even Singapore, there's only about 12 to 17% uptake. So it really isn't. It's a supplement, but it should not supplant contact tracing. The second problem with the app, as Ross Anderson in Cambridge has pointed out, is you get lots of false positives and lots of false alarms. So you're going to be generating a lot of unnecessary work, plus the fact that you may get people falsely reporting themselves and pinging off other people, either maliciously or in order to get free tests, and that's been also reported too. The fourth problem is trust and privacy. We've got Google and Facebook helping develop this, but we know that there's a real issue with trust and privacy. And indeed, Germany has just abandoned its centralised app, and it's going to go along with the EU recommendation of decentralising the app with decentralised contact tracing. And the final issue, which is really, really important, is you can only get on top of this epidemic because it's made up of so many local outbreaks by doing this locally with local teams and devolving it. At the moment,
Allyson,
this app
Pollock
is bypassing the healthcare system and the healthcare professionals entirely.
Professor
and that
Allyson
will make
Pollock,
a real problem.
thank you very much indeed. We must end there. Many countries are ahead of us as they tiptoe gently into easing at least some restrictions. So how are they doing it? Let's hear from two of our correspondents.
Here in Austria, basic face masks covering your nose and mouth.